So, Namaskar everyone. Today I'm starting with the anemia in dogs. So, if we talk about anemia, so what is anemia? Anemia is decrease in HB count or decrease in RBC count or both, decrease in both. So, that is anemia. So, if we talk about anemia, so basically, what is the clinical sign in anemic patients? So first of all, you see a pale mucous membrane and you find labored breathing. Why labored breathing? Because as you already know, hemoglobin has a function that it carries the oxygen to the tissue. When tissue lack oxygen, so automatically body responds to it and there is increase in respiration to increase the oxygenation capacity. So labored breathing is the sign. So you can say it is a compensatory sign, compensatory response to anemia. All things you tachycardia you may find cardiac murmurs. They are called anemic murmurs, right? Anemic murmurs. These are sounds on auscultation, anemic murmurs. Next thing is if we talk about RBC production. RBC production, where it happens in bone marrow. Then they release into the circulation. Where they reside for approximately 3 months, and after that their components get removed and recycled. So this is a normal process. So if we talk about when RBC count will be low, there are three conditions. Either production is less, either there is increased lysis of the cells or RBCs, or there is loss of RBCs. So if we talk about production, what are the conditions when there is decreased production of RBC? Maybe poor nutrition, problem with the bone marrow. We call it as bone marrow aplasia, right? Second condition is CKD, chronic kidney disease, because kidney release erythropoietin hormone. So erythropoietin, what is the function of erythropoietin? It helps in erythropoiesis, RBC production main role as well. So these are the few conditions when there is decrease in production of RBC, right? So some toxins, some chemicals, they reduce production. Some chemicals or toxins, right? Some autoimmune diseases. What are the conditions when there is lysis of RBCs? So IMH is one of them. IMH, immune mediated hemolytic anemia. This is a autoimmune disease. Some parasites like Babesia, so they will cause lysis of RBC. Some toxins like rodenticide poisoning, rat poison, they cause hemolysis of the RBC. Some toxins like snake venom, they will cause hemolysis of the RBC or lysis of the RBC. And some onion like in dog we should avoid these onion or garlic because they will cause hemolysis. So there are some reasons when there is mechanical fragmentation of RBCs, that may be the reason for lysis. Loss. So what are the conditions when there is loss of RBC? So loss occurs when there is hemorrhage in the body, hemorrhage, or there is severe infestation of blood-sucking parasites, blood-sucking parasites, blood-sucking parasites, or hookworm infection, severe hookworm infection. Hookworm is uh, then then some tumors, when there is trauma, there is severe hemorrhage. So that may be the reason for loss of RBCs. So if we talk about diagnosis of anemia, we talk about diagnosis of anemia. So coming to the diagnosis, so first of all, we go with the complete blood count. Complete blood count on CBC, we evaluate PCV, we evaluate RBC count, we evaluate HB. So coming to the PCV, so PCV generally PCV range in dog should be 35% to 55%. So if it is below than 35%, animal is anemic. So then from this we confirm that it is anemia. Now we come to the point what kind of anemia it is. So we should move on further tests. So we go for reticulocyte count or and reticulocyte count and blood smear examination. Blood smear examination. So reticulocyte count. What are reticulocytes? These are immature RBCs. Immature RBCs. So based on reticulocyte count, we come to know whether anemia is regenerative or non-regenerative. So what is regenerative anemia? When there is deficiency in the deficiency of RBC in the circulation, bone marrow responds and it releases immature RBCs into the circulation. So reticulocyte count will be increased. So it means anemia is regenerative, means bone marrow is responding. It is a good sign. It should be present. It should be present because if there is low reticulocyte count and anemia is there are chances that anemia is non-regenerative. That means bone marrow is not responding, bone marrow is not releasing these cells into the circulation, right? So on blood smear examination, you see some kind of parasite like vaccia, or you see right abnormal cells. Sometimes there is case of leukemia. So in leukemia, TLC count is higher, but TLC count higher doesn't mean it has a leukemia. It may be simple leukocytosis. But if there are abnormal cells in the circulation, normal leukocytes in the circulation, and there is increase in TLC, that there are high chance that it could be a leukemia or a blood cancer. Next test we can add on, that is very important test. That is very important. Slide agglutination test. Slide agglutination test. So what is that? So basically, in this test, we come to know whether anemia is autoimmune mediated or immune mediated or not. So this test is for to confirm the IMHA, immune mediated hemolytic anemia. In IMHA, there are increased number of spherocytes. What are spherocytes? Spherocytes are basically RBCs, but they are in spherical appearance, spherical shape. They are in spherical shape. So this is a slide agglutination test. So basically, in this test, we check the agglutination, whether most of the RBCs they agglutinate or not. If they agglutinate, it means there is a case of IMHA. So then next test, if suppose bone marrow is not responding and anemia most probably is non-regenerative, then we go for the bone marrow biopsy. We go for the bone marrow biopsy or aspirate. So we then evaluate the different size types of cells. So right, then we add on biochemical test, urine analysis. So these basically test evaluate the